Hi everyone, it is great to have you back on the channel. This is the 5th video in FutureDoc's UCAT series, and in this video we are going to be talking all about the situational judgment test. The situational judgment section is very different to the other academic sections of the UCAT exam, and it can be quite tricky to navigate if you don't have the right framework and the right skills to answer the questions. So in this video, I will be going through everything that you need to know about the situational judgment test to help you score as highly as possible. Also, remember to keep watching until the end of the video, where I'll be sharing our 3 best tips to help you absolutely smash the last section of the UCAT exam. Let's get right into it. The situational judgment test tests your way of thinking and isn't something that you can cram into revision a few days before the exam. It assesses your capacity to understand real-world examples and to identify critical factors and appropriate behaviours in dealing with them. The questions themselves don't require medical knowledge, but they do require you to have a certain mindset or way of thinking, as the test assesses specific themes including integrity, raising concerns, taking initiative, personal bias, pressure, and prioritization. This section is used in medicine to evaluate the professionalism of the candidate, as well as identify attributes that doctors should possess, including empathy, integrity, adaptability, resilience, and teamwork. In this section, you will be presented with 69 questions within 22 scenarios. The scenarios are usually based in a university or a healthcare environment, and the main character will typically be a medical or a dental student, but could also be a doctor. There are 3 main types of situational judgment question. You could have importance questions, appropriateness questions, or most or least appropriate questions. Let's look at each one of those in more detail. Starting off with importance question. For this question type, you'll get several responses after each scenario, which you will need to rate on how important they are based on the context of the scenario. You can be asked to choose one of 4 possible options: very important, important, of minor importance, or not important at all. Or you can be asked to choose one of 2 possible options: important or not important. Let's take a look at an example. A busy clinician witnesses a receptionist in a patient waiting area trying to deal with an angry patient. The patient is shouting at the receptionist because he has been waiting for over an hour. The receptionist looks shocked by the patient's behavior and asks him to sit down. The patient slams his hand on the reception desk and continues shouting. How important to take into account are the following considerations for the clinician when deciding how to respond to the situation? The impact of the patient's behavior on others in the waiting area. Is this A, very important, B, important, C, of minor importance, or D, not important at all? Take a moment to pause the video here and try to answer this question yourself. The correct answer here is A, very important. It's really key that you bear in mind that the question is asking you about what the clinician would do. This is different to how perhaps a medical student would behave in the same situation. It is very important to take into account the impact of the patient's behavior on others in the waiting area, and this is because it can cause others to feel uncomfortable and unsafe. An angry patient may come across as quite threatening, and therefore it's very important to protect the other people in the waiting area. And so it is very important to take this into consideration. Moving on to the appropriateness questions. Similar to importance type questions, you will be presented with a scenario and then given some options to choose from. Each response in the scenario needs to be rated according to how appropriate it is in the context of the scenario. And you can be asked to choose one of 4 possible options: very appropriate, appropriate, inappropriate, or very inappropriate. Or you could also be asked to choose one of 2 possible options: appropriate or inappropriate. Here is an example of how to tackle this type of question. A dentist is undertaking a routine checkup on a 10-year-old boy. During the checkup, the boy starts crying violently and screams that he wants to go home. How appropriate are each of the following responses by the dentist in this situation? Carry on with the checkup as normal. Is it A, a very appropriate thing to do, B, appropriate but not ideal, C, inappropriate but not awful, or D, a very inappropriate thing to do? Again, take a minute to try and work this out on your own before carrying on. The correct response here is D. Carrying on as normal would be a very inappropriate thing to do. And this is because the dentist should always be acting in the patient's best interests. The patient in this case is the child, and the child is obviously not having a great time. Carrying on with the examination while the child is in so much distress may have a very negative impact on the child and may result in the child remembering that experience as a very traumatic one. And finally, we have most or least appropriateness questions. For this question type, you are again presented with a scenario, but this time you are given 3 possible responses underneath the scenario. You will then need to choose the most appropriate and the least appropriate responses and drag them into the boxes accordingly. Let's have a look at an example. A group of medical students are working on an assignment that is due the next day. With little time to spare, Mary, or Marie, the group leader, wants the group to focus on the task. However, 2 students, Danielle and Joshua, have started to have a heated discussion because they have differing opinions regarding the approach that should be taken for a small part of the assignment. The discussion is distracting the group from the overall task, and the remaining group members look uncomfortable. Choose both the one most appropriate action and the one least appropriate action that Marie should take in response to this situation. You will not receive any marks for this question unless you select both the most and least appropriate actions. The 3 options are: ask Danielle and Joshua to leave their discussion for later and focus on discussing more important things, interrupt the discussion and ask the group to vote on the matter that Danielle and Joshua are discussing, facilitate a discussion between the group regarding the issue that Danielle and Joshua are discussing to agree on pause the video again here and try this yourself. So for this question, the most appropriate thing to do would be to facilitate a discussion between Danielle and Joshua. This would be demonstrating good leadership skills by turning a heated discussion into a discussion where you are facilitating good communication. Importantly, trying to resolve the conflict and find a practical solution will result in overall benefit for the entire group. Importantly, resolving conflict and finding a practical solution will benefit the group as a whole and will help the group to finish their task. The least appropriate thing to do would be to ask Danielle and Joshua to have their discussion later, as there are more important things to do. This would be the least appropriate thing to do because it dismisses Danielle and Joshua's opinions, who, although aren't going about it in the right way, still very clearly feel like it's something important to discuss. Dismissing their points for more important ones will alienate them from the group and won't actually resolve anything. It might also push them away and make them feel a bit unwelcome and will result in inability of the group to work together. This is not a good demonstration of what a good leader would do. Now that we have familiarized ourselves with the different question types that you will find in the situational judgment test, here are 3 top tips that will help you score in Band 1. Number 1 is to go through the General Medical Practice Handbook for medical students. Most of the themes in the situational judgment test are picked up from this guide, and the best way to get an idea of the mindset that you need to have will be by reading the book. It shouldn't take too long, and it's not absolutely necessary to memorize everything that you read. It's just to give you a general gist, an idea of what to expect and what you should be looking out for. This guide is kind of like a blueprint to the SJT, as many of the themes are also found in the GMC as well. So I highly recommend that you take some time to get familiar with it. Tip number 2 is don't think about what you would do. The questions usually give a scenario where you are a medical student or a dental student or a doctor. Make sure that you read the question carefully and that you take into consideration the role of the person you are presented with. For example, as a medical student, you might not be able to do some of the things that a doctor would do, like giving a diagnosis or prescribing some medication. So make sure that you keep this in mind to avoid being caught out. Sometimes the course of action that you yourself would take might not be listed out or might not be presented in the scenario. However, don't let this distract you from the question. You have to focus on what is given to you in the scenario and in the questions, and choose the option that seems most ethical to you. And tip number 3 is to rate the response, not the scenario. Sometimes the situational judgment test scenarios can be negative or positive, but the response might have the opposite effect. So you have to ensure that you don't fall into the trap of rating your answer based on the scenario rather than the response. For example, the scenario might say that a medical student has messed up a patient's notes, causing confusion to the patient and the medical staff. However, the response may say that the medical student acknowledged their mistake and has apologized for the confusion. Even though the scenario itself was negative, the medical student's response demonstrated honesty and integrity and therefore was positive. So we are now at the end of the overview for the situational judgment section. So to summarize, the questions in the situational judgment section can be tricky, and it can be hard to know what the correct answer is. But the trick is not to think about how you personally would answer the question, but rather what would the GMC say that the correct option is. A lot of people focus a lot more on the other sections of the UCAT exam, as they don't believe that the situational judgment test is very important. However, this does form part of your application to medical or dental school, and it will be assessed. So by spending time and effort on this section of the UCAT exam, you should be able to achieve a Band 1. If you need any more support with your UCAT preparation or any other part of your application, then reach out to FutureDoc to see how we can help you. Thank you all so much for watching. Don't forget to like and subscribe to FutureDoc's YouTube channel if you found the UCAT training series helpful. And I will see you guys next time.